Australia's health disaster. Let's have a look. Good evening, everyone. I'm Florian Heise, and welcome to another episode of HeiseSays. I've got my evening stein of coffee, and I thought we'd have a look at a website that I think everyone in Australia needs to be aware of. I would argue that the health of Australians is the most important issue facing our entire nation. More important than anything else people are talking about. I know every article is blaming everything on climate change, but frankly, this is going to kill more people, it's going to destroy more people's lives, and it is something that we can all individually take control of and make a difference about. Now, the first step is just realizing how big the problem is. And Rachel shared this website with me, and this is Health Tracker, Australia's health tracker by area, and it was actually quite confronting, so I thought, okay, I need to make a video on it straight away. Earlier this year, at the beginning of the year in January, I did a video, taking control of your health in 2020. That's kind of my hashtag, take control of your health. That's my goal for this year. I started the year with a 5-day fast, just drinking water, eating salt. And from then, I've pretty much been OMAD, 1 meal a day, and a carnivore in a ketosis state diet. And I've managed to, lose a bit of weight, and my target now is to get my body fat percentage down to a healthy level because of all the visceral fat, the fat around your organs. One of the issues is that we're so used to seeing overweight and fat people everywhere, we're starting to see it as normal. And I'm not talking about, sort of morbidly obese people. That's what we probably think is as fat. But a lot of people are overweight, and a lot of people are obese. So let's have a look at this data, and we can enter it here. And what we'll do is we can see adults who are obese or adults who are obese or overweight. Let's go obese or overweight because both of those are a problem. And we'll do it, I think I did it males before. Let's have a look at just persons, both males and females. And we can see here a map of Australia. Okay, and we can see where they have data. And the percentages range from 43.2 up to 79.8%, nearly 80%. So let's have a look. Here we go. Goondiwindi, this area here, 72%, 75.7%. Moree. Let's zoom into Brisbane. Here we go. Salisbury, Nathan, 61.2%. Out here in Redbank, 71%. Redbank Plains, 76.9%. We'll zoom in a bit closer to the more, even the more wealthier suburbs of Brisbane. 50.7% still. 47% in Kangaroo Point. So it's good, only not half the people are overweight there. 56%, more than half the people in East Brisbane. 56.9%. Mitchelton, 67.6%. And we'll zoom further out here. You can have a look. Going down to, where is it? The Logan area here, 67.6%. 70% in Marsden. This is people. All the people in this area. We zoom further out. The further west you get. 70%, 72%, 75%, 76.8%. One thing that's interesting is WA, we're seeing it much lower. Well, not really much lower. They're not in the 70s, they're in the 60s. Which I thought was quite interesting. If any of the WA viewers could explain that to me, is it a higher meat diet? What are people eating over there? Or is this because everyone's so stressed to pay their mortgages and all the property issues? We zoom in, you can see the more affluent suburbs are generally eating better. And I would argue that's because they've got access to better foodstuffs, perhaps less processed. We'll zoom out, we'll go over to, Adelaide. Look at South Australia, guys. 70%. How much of this state is over 70% overweight? Look at that. We'll zoom in here. Inner city, you get the lowest, but it's still over 50% of people are overweight or obese. Okay? Overweight or obese. Have a look at Melbourne. Again. Western suburbs. All over 70%. The further out you get. Country living doesn't look so good for your obesity, does it, guys? 72%. 72%. I thought, that was something I was surprised when we visited family out in the country. The food stuff they had was just prepackaged garbage. It wasn't like they were eating all this fresh country food. Still came from the shops, still processed. You go inner city Melbourne, there you go, it drops down to good suburbs that are 53% overweight or obese. And you can see the chart here. Guys, you can see all the data here. So, where you are, I mean, there you go, look at Tasmania, they're not faring any better. What about Northern Territory? Litchfield, 68.9. Catherine, 77.8% are overweight or obese. Do they have any other data in some of these remote areas? No, they don't really, but... so what? Roxby Downs, 67.6%. So you can see, most people in this country are overweight or obese. Guys, that's crazy. That is a health issue, because your measurement around your gut, guys, that is the best indicator of your health and longevity, and if you will catch any other diseases. And this is a non-communicable disease. It has lots of issues. So let's have a look at what else we can see. Let's have a look at children or young people who are obese. And here we go. They've got the latest data, 7.8 to 7.4%, and they want the target to 2025 is to get it down to 6.6 or 7.5. What do we have here? Is this the children? No, that's okay. We'll bring up the children one. We'll bring up the children, because kids, I mean, could it be because they're doing all that homework like 60 Minutes said? And again, Western Australia, we've got lower obesity. Why is that? I've got no idea. Can someone tell me? But up here, in Roebourne, 9%. 9%. There you go. Catherine, 9.4. Litchfield, 7.8. Let's have a look around Queensland. It's the same thing. It's the lower socioeconomic areas out west near Ipswich. You're getting high levels, 11%. 10%. Out on the islands, 10%. We go in. St Lucia, 8.3%, that's the university area, so it's kind of surprising. 6%, and then you go a bit lower, Ascot, 5%. More affluent suburbs. It's a socioeconomic issue. I'd argue it's to do with the foodstuffs that people have access to. Probably the amount of sugary food that people are eating. And I bet you a lot of the people in these areas that are overweight are following the Australian health guidelines, the dietary guidelines. I bet you they are. Guaranteed. There you go. Let's have a look down at Melbourne. I'm there. See, it's a bit better out in the country. A bit lower, which is good, so it's different. So when they're kids young, they're still probably burning off all the energy. But when they're in the city, it kind of mimics the parents, doesn't it? How's Tassie going? Yeah, not looking too good. 9% in the wilderness. So, what else should we look at? Oh, sorry, and that's just obese. That's not obese and overweight. Obese and overweight is 25%. Sorry. So, obese and overweight is 25%. Of that 25%, 7.8% are obese. So, what does that tell us? How many are overweight? What that minus that, but 18%? A quarter of kids are obese or overweight. High blood pressure. Let's have a look here. 23%. The target is to get it down to 16.1. And we have a look at the ranges. Whoa, up to 56% of the population in some areas. We can see here, concentrated around the inner city, very high blood pressures, and lower blood pressures around, or further away, but around the coast, higher. Again, there you go, inner city, high blood pressure. Lower in the country. Are people more relaxed in the country? Are they taking a bit slower, perhaps? Could it be due with stress? Let's have a look at Brisbane. Same thing, 29%, 30%, 42.8% out at wake call. Could it be because you have the prison out there? Are they affecting that population data? Let's zoom out. Look at North Queensland. Getting right up there. How's Catherine doing? 30% high blood pressure. WA not doing so good with their blood pressures are a bit up. They were beating us on the other things. So guys, this ain't looking good either. This is not looking good. So let's go drinking at risk or risky levels. Risky levels. Which state do you think is going to be the best here for this one? Let me know in the comments, guys. And here we go. WA is caught up to the rest of Australia. You know, up to 33% of the population, guys, of the population. We can see here, I mean, have a look. It's everywhere. It's everywhere, drinking at risky levels. I mean, there you go. And this will feed into your obesity. It'll feed into a whole lot of other health issues. Same thing with Melbourne. Look, you know, some of the inner suburbs, they're, you know, 9%, 5%, up to 21%, 21%. Tasmania, you know, a bit less. Still pretty high. And look at Sydney, guys. There you go, western suburbs. Sydney's pretty good, actually. A lot more in the lower range than Melbourne or in the rural areas. I mean, look here, guys. Look how many people. A quarter of the people. A quarter of the people in these areas are all drinking at risky levels. Look at Brisbane. How are we going? We're going pretty good. There you go. Southern areas are doing pretty good. Hang on. Where am I? Sunnybank came up with me, didn't it? There we go. Sunnybank, 10%. 10%. We're not doing too bad. We're in the lowest area. I wonder why that is. What's that? I mean, we've got a probably very multicultural area. A lot of Asians here, Chinese. I mean, all the Asians I know at uni have been hard drinkers too. But I guess, you know, not as hard as some of the other suburbs. We've got to keep up. Greenbank, 19%. Yatala, 10%. And here you go. Look at this. Further south you get. Let's have a look what data. There you go. 22%. Up to 30%. Let's have a look. Catherine, 17.8%. That surprises me. I thought it would be higher. Litchfield, 16.6%. Roebourne, 22%. So we've got a lot of people drinking at dangerous levels as well, guys. Up to 33%. I mean, look at the overall numbers. 18%. Smokers. 16.1%. They want to get it down to 5%. You know, smokers is still pretty high. I mean, here you go, guys. It's the same thing. Same thing. You can correlate it with, you know, the regional areas. Further out you get from the cities. How are we going here? I mean, there you go. Drops down. Drops down. Acacia Ridge, 23%. Rocklea, you know, Richlands, Wacol, Red Plank, Ipswich. There. So smoking ain't doing too good either, guys. Similar here, western suburbs. You know, French Island. Don't have any data. So we can look at high cholesterol. That's 32.8%, 24.6%. Now I'm well, considering the diet I'm taking, I've got no concern with cholesterol, to be honest. It fluctuates a lot more than people track. When you take one measure once a year, it can change from day to day more than people realize. And we actually need it in our bloodstream. So I'm not worried about cholesterol at all, to be honest. I'm not worried about it at all. So, I mean, but here it is, guys. You know, you've got people up to 41.7% cholesterol. What are they getting it from? What oils? What fats are they consuming? How much of it is plant-based seed oils that they're eating that's driving up their cholesterol? Have a look. There you go. All the trendy suburbs. You know, some of them aren't drinking. Some of them aren't overweight or obese. Doesn't correlate. Look, 41.7%. We've got a lot of overweight people here. Their cholesterol isn't as high as the people in the inner city, which aren't overweight. Funny that, isn't it? Funny. I think your weight is the most important thing. Here's one to look at. Physical inactivity. And they want to get it down to 59.7. It's at 66.3. So we can see here, I mean, there you go. Look, up to 83.8%. Guys, in some areas. Look at that. All the rural areas really high. 76%, 73%, 74%. We zoom in. You know, it gets down to, it's good when it's 50% on this chart. So all these people are not physically active enough. And this is the thing with all the dietary and health information. People are blamed for being overweight. They're being blamed for being obese. And that they just aren't exercising enough and they're eating too much. And it's this thermodynamic model of calorie intake as a way to manage your weight. And it's an outdated theory with regards to weight loss and weight management. the other alternative theory is to understand how insulin affects the storage of fat in your body, and storing fat in your body is a necessary thing. It's an evolutionary response when your body, there's a reason why you want to gorge on fruit and chocolate and sweets, because your body wants to store that as fat for the long term, because you're not going to find those tropical plants everywhere, particularly if you're of European descent, are you? You may find a honey hive and crack it open, eat that sugar, and store that as fat to help you go through the winter. So, have a look, guys. 74%. 74.3%. And I'm probably in this. I'm starting strength training again. This is like my recovery day, or my first day doing it yesterday, and it's been a long time. So it's good. It's good. You can see, again, in the inner city, more active, but it doesn't seem to affect the... Let's have a look down here. It's not affecting their cholesterol level or their blood pressure, is it? Here in Melbourne. It's not helping. Now, we've got bowel cancer screening and those things. Prevalence of diabetes in adults. And this is like the end game, because there will be a lot of people out there that are pre-diabetic and probably don't even realize it. A lot of people out there that are pre-diabetic and have no idea. And, I definitely was on the track to being pre-diabetic. Even if I hadn't realized that I wasn't that overweight, but guaranteed with the amount of crap I was eating, I would have been heading there. So you can see here, there you go. On the 5.8% are diabetic. So we've got 5.8 to 13.8%, all the poorer suburbs. Western part of Melbourne. Geelong. Further you get out, not so much. Not so much. Or is it just because... Here's another question. Is it just because they do not have access to medical services that are going to capture that are identified as quick? 5% there. ACT, 10%. Here we have, 6%, 5.4%, 5.8%. Let's zoom out a bit and you can get an overview. Here we go. Up in Roebourne, 7.3%. Catherine, 7.8%. So again, the East Coast looks a bit sicker than Perth, but not Western Australia, but not by much. Not by much where we have the data. So, early deaths from cardiovascular disease. Let's have a look. Here you go. 187, 182. Look at that. Look at that, at all the early deaths. APY land, 423. We'll go over to Perth. Inner suburb of Perth with many more people, 33.9. Let's have a look at Adelaide. Oh shit, Adelaide's looking terrible. To be honest, guys, what are you doing down there? You're not doing good. North Adelaide, 37.7. APY land, 423. Okay, and I'm picking on APY land because I've been, talking about Minterby, so I know it exists. I know how many people are there. Not that many people living out there. Melbourne, 17 people. 33.1. 30.4. So there's some shocking issues. And look at how far the further inland you get. Now, could this be preventable due to access to health services, perhaps? Remoteness? I bet that definitely has a fact to do in it, but I think it's got more to do with data, with diet and other issues. We've got early deaths from cancer, and we'll just go through those. But there's one here. Early deaths from diabetes. We'll have a look at this. Because that's my biggest bugbear, because this can be managed. Lowering your carbohydrate levels have allowed people to reverse this, but it is not being discussed in mainstream. Doctors are not being taught this in school or university. Children aren't being taught how to manage this at school. We're just medicating it. We're medicating it, guys. Have a look. There you go. You can see, guys. We've got data, areas without it. But you see in the poorer suburbs as well. Going up to 158. APY land, 137. This is the thing with a lot of the indigenous communities. They've adopted the Western diet, and it's decimating them, guys. It's really screwing them over. I think that's worse than anything. Giving them the Western diet is probably the worst thing we've done to the Aboriginals in Australia, I'd argue, because their traditional diets, they didn't die the same stuff. You know, the Witchetty grubs were very high in fat. They were very high in fat. They were, very different, the foods they used to eat. 55.1. So, I mean, there you go. This is a problem we've got here. This is a big problem. But I think the last thing I want to look at is suicides. And you can have a look here, guys. Is that it? Yep. Look at this. All the remote areas here. All the country. Zoom in. Still in the cities. Everywhere. This is a national disgrace. So, you can see this is a very useful source of data. And just the amount of people who are overweight or obese, over 60% of the population in our country is a disgrace. Because this is going to have flow-on effects. This is going to have economic impacts on our, it'll affect the economy with regards to healthcare, with regards to taking care of these people. You're going to need medical support that you wouldn't otherwise. I was talking to a friend. We were designing hospitals. We had to take account of extremely obese people, bariatric designs for furniture that was like double side, double strength for these people. Trying to operate on someone that big, you need to really have stronger equipment. Some places aren't set up to deal with it. And the problem is, most of us are obese or overweight. More people are than aren't. And we see this all the time. So we think that someone's skinny when they're not. When they're actually overweight. So let's jump back and let's have a look at the report card that Australia got, guys. So 1 in 2 Australians have a chronic disease. Chronic diseases like cardiovascular disease, cancer and diabetes are the leading cause of illness, disability and death in Australia. I would say, well, fatty liver disease is one of the so common in Australia, and it's so common in the world. I think the number of people that are pre-diabetic is a big problem. Almost 1/3 could be prevented by removing exposure to risk factors such as smoking, high body mass, alcohol use, physical activity, and high blood pressure. So high body mass, reducing your weight. If you want, look back at my earlier videos. Look back a couple of years ago and see how I've probably lost, I think I was at 95 at the highest. And I've lost all of that just changing diet. Can't say I've been exercising very much. I've been pretty slack with regards to that, to be brutally honest. Just changing diet. And I've been eating to satiety. I've been trying to go OMAD and I haven't been eating enough in one meal. So, look into that, guys. Take charge of your own health. Because this body weight, everyone can reduce. Everyone can find a way to do it, guys. Despite the need, only 1.5% of health spending is dedicated to prevention. And that is the thing, because our health industry, it's what is the term? There's a doctor I'm watching, he mentions it all the time. It's a disease treatment industry, not a health not a health promotion industry. We're not promoting health, we're just treating disease. How many people get out of disease? So we'll just skip that and look to some of the charts here. So this is their target, 25% reduction in smoking. Reduce smoking to 5%, 20% reduction in harmful alcohol, 10% reduction in insufficient physical activity. Well, actually, I'm at a standing desk. I've had a standing desk for years, so I mean, does that make a difference? Okay, now this is garbage here. Reducing the average intake of salt. No. That's not been proven anymore. That's out of date. They need to update the data. I mean, this is 2016, so I'm imagining that hasn't been revised. But salt isn't the issue. The problem is health guidelines want to put your salt down to a level that is actually quite dangerous. Salt is not a problem. That's one of the things you need to do when you, particularly if you go onto a carnivore diet or a keto diet, you actually up your salt intake to address cramping. Because we've been pushed for such low salts, and the actual level they recommended are lower than what people need to function properly. Reduction in smoking, yes. Reduction in suicide rates, yep. Halt the rise in new diabetes, yes. Well, that has to happen. That needs to be done with our diet, and people need to understand. This whole the diabetic organizations are still telling people they should be eating carbohydrates. When no, you shouldn't be eating any carbohydrates at all. That's what causes your insulin spikes. What drives up the glucose, then your insulin goes on. You got diabetes because your body has built up a resistance to insulin. It used to be called sugar, the sugar disease. Because that's what it is. Halt the rise in obesity, yes. Do that with diet. Halve the employment gap for people with mental illness and improve participation of young people with mental illness in education, employment. I would say a lot of our mental illness can be dealt with dietary issues. If you look into the number of cases of people that are changing their diet and addressing depression, it is surprising because a lot of dietary deficiencies can present as depression. And Dr. Berry does a whole series of videos on that. And you hear constantly of people who were depressed and on vegan and got this illness, then just switched to meat, and it all started lifting. You know? And we'll skip this because I want to look at some of these figures. So adults who are overweight or obese, 63.4%. And the indigenous data is 71.4%. So this is the gap. This is the gap that matters, guys, between indigenous and non-indigenous people. You know, adults who are obese, 27.9, 41.7. 41.7, guys, for Aboriginals. That's dangerous. That is insane. Adults not meeting their physical activity, 44.5, and here you have 65%. Adults consuming too much salt. Yeah, well, I'm not a fan of that. I don't trust that metric anymore. I used to believe it, and then I found out the data that they were used to initially make the argument against salt intake was based on one sample of one extremely remote community, and yeah. The problem is, and the methods used in epidemiological research with regards to nutrition is often based on survey data. So it can be memory-based survey data where it's questionable if the data is, well, accurate. You know, can you remember how many servings of meat you had 2 weeks ago? And when they're doing all the, when the vegans are prattling on and on about their rubbish, and they'll say, oh, look at meat eaters, look at meat eaters. They're not comparing it to meat eaters. They're comparing it to people on the standard American diet who eat a little bit of meat. They're not comparing it to carnivores. Because that's just become a new trend. And there's a lot of people out there that are very healthy. Look at the 7 Nations study. Okay, and this is part of the reason why I am skeptical about anyone who makes a appeal to authority, who makes a claim that all the scientists agree on this, so it must be real. All of the few nutritionists and dietitians used to agree on the 7 Nations study, and now that has led to these chronic health issues we have in our nation, where over 60% of the people are overweight or obese. So, yeah, if anyone tells you that, just tell them, historically, that's been dismissed as complete bunk. Complete bunk, it's woo-woo. Rubbish. So, proportion of total energy intake from discretionary or junk food in adults' diets. I mean, here you go. 34.6%, 40%. Adults consuming too much sugar. And I think any sugar is too much. And this is the big one. 47.8. And this is where people who go off a normal diet, even if they go to veganism or anything else, if you're eating clean food and go off the sugar, you can make a huge impact. That was our beginning on this journey. We did the Daniel fast and we started losing a lot of weight. So what else do we have here? And the risk factors, look at the drinking difference, 18% to 22%. Alcohol per capita consumption, 9 liters. And heavy episodic drinking, 26%, there it's 37.8%. At least it's trending down. Emergency department presentations. Well, there you go, 5.9, 3.4, so it's heading up for both. And not available, is that because they don't have access to emergency departments in some of the remote indigenous communities, perhaps? And there you go. I mean, let's have a look. Suicide, 12, 20.3. So guys, Australia ain't doing too well with regards to our health. There are a whole lot of issues that we have in this country, and I think this is one that we need to be talking about all the time, because this is one that people can make a difference. I encourage you to take charge of your health, to check your weight right now. Go check, see if you're overweight, see if you're obese. Measure your body, take a measurement around your waist, check it to the charts from the 70s, and see if that tells you if you're overweight. Then do something about it. Take charge for yourself, because no one else is going to. Other people don't really care. You got to take care. Anyway, guys, let me know what you think. Thank you for watching. Please like, share, and subscribe to the channel. Please share this video, share these websites, get people talking about this. This is the real issue that is facing our nation. All these people prattling on, oh, the bushfires are going to end the world. You know, that's not important. You know, in 100 years' time, they'll be having another Royal Commission, because I guarantee you, they're buggered up the same thing. You know, maybe I'm just too cynical that people don't learn from the past, but I think human stupidity is a constant. Or I guess we've got more access to information. Maybe that will lift the general understanding of reality for people, and, you know, we could turn a leaf, perhaps. But this is something that can help. You can have an impact on your family members' lives right away. You know, one day you can see changes in your quality of life with your diet. Anyway, guys, like, share, and subscribe to the channel. If you're a fan and want to help us produce more, I have a Patreon where you can make a monthly donation. We also have the ability for you to join the channel here on YouTube. And if you want to support us, we have referral links for Independent Reserve for your crypto trading, and Amazon and eBay for your consumer purchases. We sell pocket squares on the HeiseSays website, and we have PayPal if you want to make a direct contribution like that. Thank you all, everyone. Have a great day, and I will talk to you later. Bye for now.